Welcome to the webinar on contact tracing for COVID-19. I'm Swaminathan, the GlaxoSmithKline Distinguished Professor of Operations and the Faculty Director of the Rethinc Value Chain Labs at the Kenan-Flagler Business School. The Rethinc Value Chain Labs studies how technology is radically transforming value chains across industries. Today's webinar will be discussing digitization of contact tracing for COVID-19 and the implications for privacy and governance. Contact tracing is a method by which public health outbreaks are monitored and kept in check. Typically, this has been a manual process in that once a patient has been tested positive for a disease, in this case, COVID-19, a public health staff then interviews the patient to identify where all they might have been in the recent past and who could have been affected by that, and then alerts those individuals and establishments so they can take adequate precautions and monitor themselves. With the prevalence of smartphones in the human population, several countries have been considering the usage of technology to make contact tracing process more automated and more effective. While there are many possibilities as to how to establish, the fundamental idea is one of utilizing the smartphone and associated technologies such as Bluetooth to digitize the contact tracing process. We are very fortunate to have with us today 4 experts who will provide insights and enhance our knowledge about the public health, technological, privacy, and governance issues related to the same. Let me take this opportunity to welcome all of them and introduce them one at a time. First, we have Dr. Jim Thomas. Jim is an associate professor in the Department of Epidemiology at UNC's Gillings School of Public Health and is the director of the MEASURE program, the program that advances capacity of developing countries to monitor epidemics. His principal interests are in social forces underlying epidemics, ethical concerns in digital surveillance, and the ethical practice of public health in a pandemic. Next, we have Dr. Stephan Biller, who's the Vice President for Offering Management at IBM Watson IoT. He leads IBM's Industry 4.0 solution products using big data, AI, and analytics to drive operational excellence from factories and supply chains to the operations of oil fields and power plants. Next, we have Jules Polonetsky, who's the CEO of the Future of Privacy Forum, where he leads a team focused on advancing principled data practices in support of emerging technologies. And finally, we have Klon Kitchen, who's the director of the Heritage Foundation Center for Technology Policy, where he leads an enterprise-wide interdisciplinary effort to understand and to shape the nation's most important technological issues. Before we turn it over to the panelists to make their initial comments, I just want to let the viewers know that you can enter your questions in the Q&A window, and after the initial set of discussions, we will entertain those questions from you all. With that, I would like to turn the microphone over to Dr. Jim Thomas.
Thank you, Jay. As Jay said, contact tracing has been used in public health for quite a while. It is perhaps most famously used for sexually transmitted diseases and identifying contacts. In that case, it's often called partner notification. And in contact tracing, the goal is to identify others who may be infected and to get to them before they infect others, or to minimize the number of other people that they infect. In mathematical terms, this is an attempt to decrease what's called the reproductive rate, or the R sub 0, which means if one person is infected, how many others do they infect? If it's a number greater than 1, then the epidemic grows. If you can get the number less than 1, then the epidemic decreases. So it's a very time-intensive and person-to-person intensive effort to get that reproductive rate below 1. Once a person is identified as a contact, they indeed are contacted. They're asked to quarantine themselves. They're advised to get tested themselves. And if they turn up positive, then the chain continues and you ask about their contacts. To do this well, to do contact tracing well, you have to earn the trust of the person that you're talking to by collecting only the information that is necessary and using it only for contact tracing. By keeping the information confidential and ensuring that the person you're talking to knows that you're going to be doing that. You need to collect helpful information to help the person with their recall in thinking back over the last few days. Who have they been in touch with and at what length and in what context? Was it a successful amount of exposure to cause a transmission? And you need to get the contacts information, people that they say that they have been in touch with. Can you give me their phone numbers so that I can contact them and ask them some questions? And then you need to provide helpful information to give instructions on isolating themselves if they're positive or quarantine if they're suspected, to provide connections to needed services and to answer any questions that they have. Oftentimes there's also follow-up when somebody is in quarantine or isolation to see how they're progressing, see what they need, anything that can be done to help them stay in place and be taken care of. There are some digital tools that have extended our ability to do contact tracing. Some of them are used by contact tracers themselves to have a central database of people who have tested infected, and then to make the calls and to record the names of the contacts so they can keep track of who's been contacted and what has been learned. There are also programs to send text messages out about quarantine and about services that are available. The ones that are of more interest, particularly for this webinar, are those that are used to identify when a potential exposure has occurred. There is a range of programs. Some of them use Bluetooth, some of them use the GPS systems in the phone. There is a program that is used in South Korea and China called Hamagen, if I've pronounced that correctly. It has a centralized database that is run by the government. It collects geolocation data and medical records and allows those two to talk to each other. So it's pretty all-knowing of who has been where and what conditions they have, and gives the public health offices in those countries the ability to contact people and with some knowledge of whether they have indeed been exposed. The Bluetooth technologies, there's one of those in Singapore that is called Trace Together, and these require a voluntary download of an app to a phone, a voluntary data entry if the person proves to be infected. And with that information, if let's say I am that person, I've been infected, I have that app. If I stand next to somebody for a period of time and they also have voluntarily downloaded that app, then our phones communicate, and an encoded number is put on their phone that says that they've been near me, and they later get notified that I was infected, though they don't know it's me, and they just know that they've been exposed. So it's kind of like a check engine light on a car. So the contacts then need to self-quarantine if they choose to follow that information. In the US, well, in Singapore, there's an opportunity to share that information with the health department. In the US, there is an app where under construction development, where that information will not be shared with the public health department. And health departments are, by and large, finding that the app as designed for use in the US is going to be less helpful for public health than it is in other countries. And they are putting their attention more into the traditional contact tracing and the other smaller apps. I'm going to end with these comments. There will be, you're going to learn a lot more from those who follow me. I want to end by just listing a number of questions that we in public health would have for any tools that are developed. They are, what problem does it solve? Was that problem a high priority in the first place? Does it effectively solve that problem? Does it create new problems? And is there a net benefit? So I will stop there and hope to talk to you again when there are questions.
Moving on to Stephan.
Yeah, hi, thank you. Thanks for attending the webinar. As Jay said, I work at IBM. I work on Industry 4.0 problems, and primarily I work in manufacturing settings and supply chain settings. So COVID obviously had a huge impact here, and you have all seen this through infections in meat packing plants and so forth. And as we are reopening, and if, manufacturing is usually one of the earlier ones that gets reopened, the businesses have to create new business processes. The manufacturing in particular has been used to this paradigm of lean manufacturing, which essentially means to try to eliminate as many unnecessary movements as possible. And if any of you have ever been part of a lean workout, and I personally have been part of many, what you see is that people are trying to put workers closer together to make them more efficient. And obviously that is something that we now have to unlearn and redo as we are opening up manufacturing plants. So since safety and health is the paramount driving force for any employer, you have to think about how you redistribute the work in a lean manufacturing factory, so that you can distance the workers by at least 6 to 8 feet. Of course, you provide PPE and mask and so forth. I think that is certainly number one. At IBM, we also have been developing an app that we had used for worker safety that essentially worked by using an iPhone and trying to keep workers away from hazardous sites within the plant, and that we could actually trace if somebody got too close to it. We could get alerts, and we would also get a history. Now we are repurposing that app and using that for contract tracing. So of course, in that context, any employer will do well to talk to their unions, to talk to their employees before they do that, because obviously there are privacy concerns of these employees that have to be addressed. And then we have to find a balance. Do we want to get contract tracing electronically, or do we want to adhere to more strict privacy concerns? I think that should be negotiated between the unions or the worker representatives and the company. Third, if you have a factory, what do you have to do? Well, first of all, you have to isolate. You have to isolate the person. They have to stay home. Now you're in a position where you have to think about how you redistribute the work, how many workers are cross-trained. And, at IBM, we have tools that help you to train those workers, but also help you in optimally assigning the workers so that most of the manufacturing can go on without any interruption. And finally, we have tools in augmented reality that help workers who might not be as well trained as the standard workers who might be out sick, that help you to guide these workers using augmented reality to perform the tasks that they have to perform. So those are sort of like 3 or 4 technologies we have been working on, and I will tell you, our clients are eager to really protect the safety and the health of the employees at all costs. And we see a significant uptick in the interest in those solutions that drive essentially the digital transformation of a factory as a whole. Finally, of course, supply chains are interrupted. You have seen this. Some car companies, for example, cannot assemble their their vehicles because they don't get the parts from their supply chain. So that's another area where you're working on that has less to do with contract tracing, but keeping the factory running. I think I'll close my remarks here and say, you know, this is a really an unprecedented time. It's scary at times, but I'm also really impressed by how the employers and the technology providers come forward and significantly help with fighting this this epidemic, and at the same time, this pandemic, and at the same time, trying to keep their businesses running the best they can.
Well, thank you, Stephan. We'll move on to Jules.
Great, thanks for the chance to join you all. Really timely conversation, very timely actually, because just half an hour ago, the APIs, the capability for apps to access this greater Bluetooth proximity type information that many of the health department apps are looking to rely on, just went live. So there are no health department apps yet that have launched that will rely on this, but the APIs are now officially open, and many health departments have either been working on apps that will use these APIs or are shortly going to be submitting them. And so I think the interesting question, as somebody who works in privacy and data protection with the chief privacy officers of many companies and with privacy academics and civil liberties folks, is what are we worried about here? Are we worried that we're giving up privacy in order to help fight the pandemic? And are we doing something that's risky and dangerous to ourselves now, or for the long term? Are we taking a step because it's an emergency by allowing tracking or surveillance that we will regret? And I think here's perhaps a useful way to think about it. Privacy really is very contextual. Most of us don't want absolute privacy. We don't want to, live in a shell or be alone on an island. We want to make sure that we connect with the people we want to connect with, our family, our friends, broader audiences, and that what we say or what we do is used in ways that make sense, to communicate, to share. It's when data is used in ways that doesn't make sense, that's wrong, that's harmful, that's risky, that we start having this privacy intrusion. The reality is most of us haven't lived through crisis situations or pandemics, but anybody who's dealt with public health, right, is quite well aware that there isn't a notion of privacy when you have a communicable disease. I've got to tell my partners if I've put them at risk of HIV. I've got to communicate that. The ethical obligation isn't that you have a right to privacy if you've done something that puts someone else at risk, right? Just like if I'm in desperate straits in the middle of a street and someone's got to, come over and pick me up. They haven't invaded my privacy. They've helped me. That's the moral and ethical thing to do. The Europeans, when they talk about privacy, don't talk about privacy. They talk about data protection. The European General Data Protection Law, the classic, largest comprehensive model that we have in the world that Europe and many countries have followed, that statute doesn't have the word privacy. It talks about data protection and balancing rights. So right now we have a situation where the balance of sharing because of an emergency, sharing to help protect public health and to help protect each other, is in some places outweighing some of my normal business where it's not anyone's business to know that I was sick and it's got no effect to you. Today, the fact that someone was sick and that it does affect you does create a balance. So we're not eliminating privacy. We are if we do it wrong. If when we do it, the data ends up being used for all sorts of other purposes, for marketing, for government surveillance, for finding out, whose immigration status, for revealing where I went, because you don't need to know where I went. You maybe need to know that I was in the same room as somebody, but we don't need to actually share personal information that can be used to embarrass me. So that's the framing. If we do this right, if we say we don't need any privacy, we have to give away privacy, we've made a mistake. If we say there are careful ways that we can balance disclosures of information with the right restrictions, the right regulations, the right technical limits, we can do it right. So here's the question. Are these new APIs the right balance? here's a little bit of the conflict. Some health departments want as much information as possible, and that's understandable. None of us have been through using apps at large scale, and we don't know what's really needed. So some health departments would like location information. Well, there's a real risk of that, right? If Apple and Google make these changes to allow greater access, they're not making it just for democratic countries. They're not making it just for the states where we've got, governors who we think are going to, act in a responsible way. We are doing it globally. And so what Apple and Google have to do, and which I think they're doing, is they're opening this in the most limited way, not providing as much as what some health departments might want, but doing it in a way that most of us, I think, could be a little more comfortable, that there's really very little risk, that my location isn't being shared, but I'm able to get an alert because I've been close to another phone, either an Apple or an Android-powered device that has come into proximity. So challenging times, but I think we've got good models of data minimization, of making sure we have a specific purpose. And if we're looking to our devices, which have become such ubiquitous tools, that we recognize that it's not going to help everybody, that there may be children, there may be economic disparities, there may be people who don't have the latest phones. And we need to think about how we're considering equity and inclusiveness, but I think we have a good path forward.
Great. Thanks, Jules. On to Klon.
Hi, thank you. I would certainly associate myself with many of the views that have been offered up until this point, as well as some of the concerns. But my role in this discussion specifically is to represent the government perspective on these matters. And so I think it is important that we begin by recognizing that the government does, in fact, have an interest in pandemic surveillance. So first, according to our Constitution, the federal government is charged with providing for the common defense. And while this is not exclusive to the domain of pandemic surveillance, it certainly includes it. And second, our ability to test, track, and manage contagions directly impacts critical government capabilities, like the provision of basic services, law enforcement, and even military readiness. And then finally, third, while the current coronavirus has a relatively low mortality rate and is unlikely to be shown to be a man-made bioweapon, such weapons do exist. And there is broad consensus within the national security community that the employment of one of those weapons would likely exhaust our national response capacity. And so therefore, what we're learning now in the context of COVID-19 will directly influence how our nation prepares for even worse scenarios in the future. Now, to be clear, none of this excuses government overreach or abuse, but it does demonstrate that the government has a compelling interest in pandemic response, and that it will be a critical stakeholder in the private sector's conversation about what work looks like in the post-coronavirus world. Thanks.
Thank you, Klon, and thank you all the panelists here. You all made excellent starting comments on the topic. I have a few questions for you, and then we will open up to the questions that the audience have. So the first question that comes to my mind is, what are some of the ethical issues related to public health as we think about digital contact tracing using smartphones? And maybe Jim, you can start with that, and the others can then comment.
Yeah, so there is a tension that public health ethics resides in between individual liberties and the good of the community. And you've heard some of that discussed in various terms by each of the panelists, trying to thread the needle in finding that place where liberties are respected, but then the public good is also maintained. And in contrast to medicine, public health will lean a little bit further in the direction of the public good. In medicine, the ethics is usually between the patient and the clinician. And in public health, it's between the government and the populace. So to take care of the good of the populace, sometimes private liberties, individual liberties need to be constrained. There are principles, ethical principles in doing that. And one of them is to use the least restrictive, effective measure. So you want to be sure that in the case of these contact tracing apps, are they effective and are they using the least restrictive measure? And I have some questions about the effectiveness of some of these tools. If I get notified that I have come within reach of somebody who is infected, it depends on whether they entered their data correctly. It depends on whether they downloaded an app and whether I downloaded my app. There's a lot of ifs, a whole chain of ifs in this technology that makes it of questionable use to public health, which is that effective part that I'm questioning.
So Jules and Klon, how do you react to that?
I'll jump in quickly. Look, in the ideal world, this is not the process, right? In the ideal world, we would be studying how have these apps worked in the past? What was effective? Do you need location? Can this be done with Bluetooth? How far away from someone and for how long? And how does that correlate with signal strength of Bluetooth signals? We haven't done this. How much of the population has to download it, not for it to be significant in battling the pandemic, for it to be useful, that this is another supplement. You saw the confusion with masks. Don't buy masks. We need it only for emergency workers. No, everyone should have a mask now, right? And we're figuring this out on the fly. Is it right that private companies are the infrastructure for critical public health? In an ideal world, we'd have a system. I'm working at home, I can work at home. If I'm going to receive an alert that says, maybe you were near somebody, but it's not clear, your phone was near, I can be conservative. I have an immunocompromised member of my family. I have elderly in-laws nearby. I can say, no big deal. I'm not going to go hungry because of it. I'm being paid. There are other people who won't be paid if they get an alert. So the challenges are immense. And this is not the ideal way. In an ideal world, we'd be already having every contact tracer with every tool working aggressively. But we're in an imperfect world. And if our question is, can this be a tool? If you ask me where I went last Thursday, if it's not on my calendar, I don't know. And if you ask me who was actually, there and near me, good luck. So I think for many of us, the speed of an app, the ability to cast broadly is going to be a learning experience, but I think it can play a useful role if built with the right privacy protections. The data being deleted very quickly as the current Bluetooth APIs intend. And at the end of the day, if people trust it enough, and it's mixed in terms of whether people are going to be comfortable enough. The important thing is that these are coming from health departments, and they are today the entities that most of us are looking through as the people who can, help shape us through this. So I'm optimistic, but I think it is fraught with ethical concerns, which we need to be aware of. We need to study and understand, and hopefully tweak this as we go. This is going to be a long process.
Yeah, Jay, the only thing I'll add to that is because of the constraints that Jim noted, it's one of the reasons why both Apple and Google are not referring to this API as contact digital tracing. They're referring to it as notification. Mm-hmm. So it's not intended to provide all of the solutions that a traditional dedicated contact tracing capability would do. It's not a replacement complete of manual contact tracing. It is instead them leveraging their platform. By the way, Apple and Google constitute 99% of the US mobile phone market. So when we talk about users of those two phones, we're talking about pretty much everyone. And so what they're doing is they're seeing a very real deficiency in the government response right now. Manual contact tracing is not keeping up with the speed of transmission. And they've got both a vested interest. They want their employees to get back to work. They want the U.S. economy to get back up and running. And I think we can ascribe some altruism to them as well in terms of wanting to provide a public service where there's a clear public need. But they're not trying to do a wholesale replacement of digital contact tracing. They're simply trying to use their platforms as a mechanism of having people be notified that they may have been in contact and then to take precautions that they might not take otherwise.
Yeah. So those are great points in terms of both the things that we should watch out for and also the ways we can actually leverage the technology. Stephan, you talked a little bit about tracing and internal to the organization. So can you shed some light on what are some of the fundamental differences we should think about between within workplace contact tracing and contact tracing in places of social interactions? And in a broader perspective, what types of changes will be required in terms of information sharing in the extended value chain that we all operate in?
Yeah, so let's take the extended value chain first. If we are really just concerned about contracting the virus, we all get packages from Amazon, I still wipe them down. I'm not sure that's still necessary. Maybe it's overly cautious, but I think the same thing sort of applies in the broader value chain when you get things from your supply chain and they have been in transport for several weeks. Most likely, you don't need to go back to your supplier. But within the factory, where you have short distances between employees, I think it's very different. And I think here, unlike the public health piece, we have a very different situation because we are really have a very confined space. We have a small number of people that we really need to take care of. They all can carry an iPhone or an Android phone to make this work. And you have supervisory powers to some degree over these workers, right? So I would argue it is in their best interest to accept the tracing. I think it's in the best interest of the employer to do it. I think you have to be very, very careful what you do with that information. I think Jim said this at the very beginning. Could you figure out that somebody takes extended bathroom breaks through this app? Yes, of course you could. Is that smart? It is absolutely not. You want to be transparent. You want to be honest. You want to get your workers' council or your union, if you have them involved. If you don't have them, I would use the most senior employees in that factory and show them how it works and what you are intending to do with the data and how long you're going to store it, and just be very, very transparent. But I think we have better opportunities in a confined space like that to learn and to figure this out in this context of employment. And in the end, we all understand that these companies can't last forever without getting the cash they need to pay their employees. So it's in the interest of both the employer and the employee to make this somehow happen.
Anyone else?
Well, I will jump in to say that there is a real healthy debate now about employer apps. Clearly, health departments have a key role and should be the point. There were some concerns early when these apps started being discussed that they could be triggered by people who would be pranksters or trolls and so forth. And, it looks like Apple and Google have said they only are approving health department apps, at least that leverage this API. So currently, an employer app would need to work either with location or other abilities to learn information about Wi-Fi networks and other IoT type information that a device can use to sort of map itself to a space. There are some in Congress who are worried that if employers mandate this, and again, someone gets sent home and doesn't get paid, it's quite tricky because obviously if I'm an employer and my option is to shut down an entire floor because somebody was sick, or I can do something more nuanced and say, no, only these offices or this line, in a factory, you can see the value. But I think the concern is mandatory, and is mandating that employees participate in some way undermining the notion of these things being, voluntary tools. So it's a challenge, and I don't frankly know the right answer, but I can tell you that, there's obviously the Apple and Google structure has been set up to only allow, quote unquote, purely voluntary. Now, how they will deal with health departments around the world who perhaps mandate this in a regulatory way. Now, is that really voluntary? The App Store terms say it's got to be voluntary. Who's going to be, checking up on this? And also, some of the critique has been in foreign governments. This has been in France in particular. Who are you to tell us about privacy? You're the big tech company. We criticize you on privacy. We're the leading data protection authorities. We are comfortable setting our own rules. But of course, when it comes to crypto, we say, listen, if you're going to undermine, the basics of crypto because you trust a particular democratic government, because they're only going to do things right with oversight, once you make that decision, you've opened up a hole that is going to put people at risk all over the world because of all the different countries. There are people who don't always trust aspects of our government and, are debating and pushing back and nervous about whether ICE or whether law enforcement, can and should have access to certain kinds of data. So I think they're making the right decision, but it's certainly becoming a stressful thing when it comes to figuring out what employees and employers should do.
So that's a great segue onto the next question I have here, which is, you alluded to some of the different countries and different governments taking a different type of stance on this, but we also know that there is a general fear, or within quotes fear, that when there's an integrated, centralized contact tracing that has been proposed to governments and countries, this poses greater risk for individual data privacy and governments' potential future usage of such data. And so what are some ways to navigate this challenge? So maybe Klon, you can give us some insights on that, and everybody else can feel free to jump in after him.
Sure. So a couple of pieces of context here. As Apple and Google and other technology companies seek to meet this demand, one of the interesting things they're going to have to navigate is categorically different postures on privacy across the globe. So we were just talking about the United States and Europe a second ago. Well, interestingly, in the United States, the default position is, I'll give these companies whatever they need so that I get good services. I don't want the government to get this information. Whereas in Europe, it's often the opposite. We'll give the government whatever it needs to do what it does, but we're highly skeptical of these companies. And the companies have to navigate both of those. And that's just a peculiar context. Now, right now we're talking about, in the case of mobile phone capabilities, we're talking about Apple and Google. But there's going to be an entire industry of, or an expanding industry of business surveillance, and it's going to have a whole host of justifications, and public health is going to be one of those justifications. And it should be said, there will be very real material value in taking the information that is collected through these capabilities and commingling it with other data that these employers are going to be collecting. It will offer real insights, both from a employee and human personnel standpoint, but also from a business operations and efficiency standpoint. And so there are going to be, once we get over this initial, where everybody's kind of got religion on privacy right now, after we get over this initial hump, there's going to be a very real drumbeat. There will be entire services that offer to do that integration for you and to use AI algorithms to derive those insights so that you can be, and look, in a world of constrained budgets and in a downturned economy, those types of efficiencies are going to be very attractive. So we just have to understand that there is going to be that as a defining context. Right now, in the case of the United States, industry is doing a good job. Apple and Google have chosen to constrain what they're going to allow. I think that type of private sector driven response is preferable. But at the point where the private sector loses, sufficient legitimacy in the public eye, we may be in a place where we need legislation.
Jules, do you want to comment on that?
Well, there are a couple of efforts that have been posted the last 2-3 weeks by leading members of Congress seeking to create COVID-specific legislation. I'd argue first that we need comprehensive privacy legislation in the US. We're one of the only democracies in the world that doesn't have one. And even if we think that in the ideal world, industry self-regulation is a good idea, we no longer have that because the states are passing privacy legislation. And once California has passed legislation, we have a de facto standard. And now many other states are going to pass. And so we'll have de facto multiple conflicting standards. And the principles, which would have been very far apart years ago, when I was a chief privacy officer many years ago at AOL, for instance, the industry didn't agree that you had the right to access your information. Well, yes, if it's credit information, you have the right because, you could be turned down for credit or employment. But why do I have to give you your information? It's my business information. It creates too many problems. That's not a debate anymore. That's been the law in Europe and elsewhere. It's now the law in California. Access, being able to move the debate has really progressed to where industry and civil society are not very far off. Where they are far off is whether you should be sued in class action lawsuits for this, or whether we can trust the Federal Trade Commission and attorney generals. So Europeans have moved very quickly to advance the use of COVID data far more quickly than the US, even though they have restrictive law, because they were able to look at their law and say, well, this usually wouldn't be allowed, but we have exceptions for public emergencies or for things that are proportionate and limited. So we can and should use this. Even Germany, which is well known for having sort of among the strictest views, the Germans moved very quickly and they've got workplace guidance. Today, talk to employers in the US. They think they can do thermal scanning, but they're not sure. They worry that they're going to be sued if someone gets sick because they came back to the office, but it's not clear to them exactly, can they give tests? Can they administer tests? It is complete chaos because we don't have clear federal guidelines that say this is the proper practice. So if you're too strict, you're doing the wrong thing. If you're not strict enough, then maybe you'll be sued. So this is a case where business and civil society would gain. And it's a shame that we didn't do this last year, last month. And the sooner we do it, the more stability we'll have both for research, both for privacy, but also for industry baseline.
Great, thanks. So I think we have a number of questions here that have come up, and I want to go through them and give an opportunity for you all to respond to it. One question, which is a follow-up on what we just talked about, is what's the current thinking around how long such data would be kept? Is there any protocol or any kind of thinking around, is it going to be a few days or is it going to be a few months or a few years? And so this is part of the privacy concerns that an individual might have.
I have seen numbers like 3 weeks that the data are kept. We've got an incubation period of, we think of it roughly at the upper end of being around 2 weeks, and you can add another week on that for safety. It's in that range.
And the Apple and Google APIs, which again, this is just for the Bluetooth data for the apps that are going to be developed that only do Bluetooth, are automatically cycling the data every 30 days. Obviously, other health departments will be using location, will be, existing separate from these new Bluetooth APIs. North Dakota has one, a few other states have one around the world. And obviously those are the, periods that will be needed for health departments to figure this out. But Apple and Google have sort of set a cycle where that phone will flush it every 30 days.
The other question, which is kind of a follow-up to our discussion here, is, what's the current thinking around how this data collected for contact tracing could or should be used for the research around the disease itself or for other public health concerns?
Well, so with the data being deleted, automatically deleted, it makes it very difficult to use for research unless you can do some analyses immediately or de-identify. Much of this data is already de-identified. Perhaps going through an institutional review board, an ethics review board, you could get access to the data in a way that doesn't allow you to get back to anybody, but allows you to analyze the utility of the app.
All right, let me moving on to the other questions. So there is a question that is particularly referring to Klon, and that is kind of questioning government's ability to utilize the data, and talks about data breaches and that could cause direct harm to individuals, and looking for thoughts around, how do we think about more generally, whether it's government or whether it's big tech, which has 92% of the market share, data breaches, and what kinds of things we should be worried about as we think about releasing this type of data into the domain.
Good. It's a great question. It's the right question. So as what I'll call health surveillance comes online more robustly, one of the key concerns that we ought to be thinking, and particularly business leaders need to be thinking about, is how you're going to secure that data. Mm-hmm. If you ask me, what do I think is the more likely concern? It's data loss, data leakages, cybersecurity challenges associated with private sector collection of this information. I'm actually not worried, not because I don't think it's important, but just because I don't think the situation is lending itself toward government surveillance on these issues. I think there's going to be a lot broader, when we think about the threat surface, that threat surface is about to expand rapidly. I think there's 2 points that I think the people on this webinar should have very clear in their mind. The first point is, one, there is a distinction between what the underlying API that is being built by Google and Apple, what it collects and what it enables, and then also the rules that Apple and Google are putting in place for apps that use that API, but then also what an app using that API can ask for. And so if the CDC, for example, pulls together a contact tracing app that uses this API, I would expect that app to ask many of the same questions that a manual contact tracing individual would ask when they had a clipboard, right? And so it's not typically that these tracing apps are going to collect new or more or different information. What they're actually doing is allowing that relatively same information to be collected at scale and at speed that keeps up with the speed of transmission. That's the value add. And so if you were to walk into a hospital with a cough and then be identified as having tested positive for the coronavirus, Jim, correct me if I'm wrong, but I think what that would happen is your information would be taken down. They would ask you about contacts, and that information very likely would be fed on to public health agencies so that they could add that to their data set. So we're not talking about categorical new uses of data. We're talking about, frankly, an innovation in how quickly we can get that information and at scale.
Great, thanks. This one is actually for Jim.
Okay.
And the question is,
before you ask the question,
do you want to add something, Jim?
Can I just say something to Klon? You're
Absolutely.
Right that that's the process that would occur, and I agree in that the value added is the speed and the scale. The question I have is regarding really the interoperability of those data with other data, and what new, shall we say, animals can be created when you're able to mix large amounts of data.
All right.
Go ahead with your question, yes.
Yeah, so the next two questions are kind of combine the two into kind of one question, so it's easier for us to address all these different questions that are coming in. But basically, Jim, this was more in your area of expertise. which is basically asking the question, okay, if we have an app that informs where a COVID person has been around without identifying him or her, is that useful from an epidemiological perspective?
Well, so in the app in Singapore where they are doing that, the health department is able to get access to, I don't know whether it's voluntary or involuntary. I'm sorry, I don't know that detail, but let's just say it happens. And they're able to get access to the list of those Bluetooth proximity sensed other phones. And then they're able to call those people and go through the contact interview. Absent that, and the case that I understand is the way it's playing out in the U.S., the health departments do not have access to that. It's just the individual themselves, the private person, who gets notified, and they have to interpret what has happened and what they should do, and that contact. We can't call it tracing. Notification was used earlier in this webinar. That notification I get and a few others get, it becomes a voluntary act of what I'm going to do with that. One of the concerns I have about that kind of a notification is that I don't know how much confidence to place in the verifiability or the reliability of that information of whether I was truly exposed. And then my fear is that the notifications I'm going to get are going to begin to have the feel of a car alarm. Mm-hmm. You know, we've all been in a parking lot. When we hear a car alarm, we just don't pay any attention to it anymore because we've gotten numb to them. And that's one concern I have about these Bluetooth capabilities. But before I end, I want to say I fear I'm going to be seen in this webinar as a naysayer against these technologies, and I am not. I'm just being a healthy skeptic, and I believe that we do indeed need to move towards some of these technologies.
So another very interesting question, which is open to everybody, but I think Jules, you are the one who talked about some of the implementations outside of the United States. The question is, you know, what can we learn from these contact tracing applications and approaches that South Korea or China or Singapore have done, and how can we make our approach even better than what they have been able to do?
I think the biggest lesson is that none of these have gotten massive adoption, and you know, clearly the highest value and certainly the public health value starts kicking in when you've got enough of the population using this that, you know, you can really rely that some portion of the population is getting an additional message and an additional push, and that multiplies or is reduced in an exponential way. And so even in Israel, the Hamagin means the shield in Hebrew. So that was the Israeli name that the health department gave there. And Israel's done quite well in moving very quickly to contain and reduce, and has a population that, you know, is used to sort of being under threat in terms of their war or hostile neighbors. And so once there's sort of a national focus, you know, people are pretty good at cooperating, and even there, the voluntary nature. And so whether or not these can achieve any scale that will make them more than a interesting addition, I think the jury's out. Some of the polling, you know, has shown that, you know, there's a fair amount of the population that is skeptical, that's concerned. When you watch the news, you know, you see the debate over, you know, basic measures, and you know, everything's become very politicized. So I think, you know, we are going to learn whether or not we can get scale, maybe in some regions of the U.S. Or some cities where this can have impact. I think that's probably the biggest takeaway so far.
Anybody else wants to add to that? All right, I'll give one more question. I think there's one more question here which could be of interest to everybody, which is to what extent are we expecting state laws to impact collected data collected for COVID-19 purposes? Basically, what they're asking is there a chance that data collected in some states is more protected than others?
So if you're in California, for instance, the CCPA initially was going to apply to employee data. It was deferred, and so the provisions of CCPA that apply to employee data are pushed off until later in the year. But one portion that was not pushed off was the notice requirement. And so employees on January 1st of this year was supposed to give employees a new notice saying, hey, here's what we collect about you. We surveil your computer, you have HR information, so on and so forth. Many people did not anticipate, perhaps, that they might be collecting information from employees, surveying them about their symptoms or other measures that employers are taking thermometer scans and so forth. That needs to be updated. You do have biometric laws in some states to the extent that someone's using an app that uses facial recognition to identify which body is the heat-seeking, body. In Illinois, you can't do that without express permission. So there is, we focused here mostly on the apps, but the reality is for most people, the app is an interesting maybe. The more reality is Apple stores are scanning people accessing stores. Many workplaces are scanning people for temperature. Many are asking them to fill out surveys about their recent travel, their recent symptoms. Do they have any information that most employers have stayed far away from in the past? So the EEOC rules apply, ADA rules may apply. It is a complex regulatory thing. There are probably several hundred laws that are applicable at the discrimination, federal, disability, union, and state to many of the different new kinds of data collection that are relevant today for companies.
Great, thank you very much, Jules, on that remark. And let me just thank all our panelists here, Jim and Stephan and Jules and Klon for joining us today. And this was quite an enlightening conversation because I learned a lot of new things as part of this discussion. I hope you did as well. I also want to thank all our participants here for joining in today's webinar. We are going to do a follow-up webinar on May the 28th as part of the Rethinc series, which will continue this discussion and we'll look more closely at data protection laws in EU and the US and how those are having a role in terms of our response to the pandemic. So there'll be details in an email later on, so we hope you can join us for that. With that, I want to thank you all for joining today and have a great rest of the afternoon.